This is a left leg of a 75-year-old patient who presented several weeks ago with this.
This evening to bring you an important news update. A medical concern known as Warfarin-induced necrosis has affected multiple patients in the area. We're about to go live to Asian correspondent Trisha Takanawa. But first, we go to Ollie Williams with the weather.
It's gonna rain!
Thank you, Ollie. And now to Trisha.
Sitting outside of Quake Hospital with pharmacy student Sarah to explain to us what this condition is and how it happened.
Well, Tricia, let me start by saying this is a very rare condition. It only affects 0.1% of people who are treated with warfarin. And when it does affect people, it usually affects middle-aged women in the fatty areas of their body.
And how do they know if this condition is affecting them?
Well, it'll start as a pins and needles feeling with feeling of pressure and extreme pain, and it'll eventually progress until it looks like this.
The eruption will begin between the 3rd and 10th day of warfarin treatment. It usually starts with a defined edge and will progress to a red rash, which may become purple and hard. If it does not resolve, bloody blisters or bullae develop and will eventually become a necrotic eschar, which is an area of dead tissue. The most common areas of warfarin necrosis are fatty tissue such as the breast, thighs, buttocks, and penis.
Well, thanks for your time.
You're welcome.
So Doc, are we sure this is a warfarin-induced necrosis? Because aren't there other diseases like necrotizing fasciitis or venous gangrene that can present like this?
Sure there are, but there's nothing in the patient's history or labs to lead us to think that it's one of those diseases, and the patient started her warfarin therapy 5 days ago.
That's true, and it does fit the correct time window of initial peak presentation of warfarin-induced necrosis of 1 to 10 days. But wasn't the patient bridged with heparin?
No, she wasn't, but would that help prevent this problem?
Well, yeah, because there are multiple theories as to how warfarin-induced necrosis happens, but one proposed mechanism is a decrease in factors, both anticoagulant and coagulant. The anticoagulant factors, protein C and S, deplete faster than the clotting factors, factors 2, 7, 9, and 10, and this imbalance causes an increased chance for clotting initially, and that keeps the blood from reaching the skin, causes the skin to be starved of oxygen, and causes the necrosis.
Okay, but what would place this woman at a higher risk for developing this?
Well, first of all, just being a woman places this patient at a higher risk. Other risk factors include obesity, being acutely ill, high loading doses of warfarin, such as doses over 15 milligrams, and protein C, S, or antithrombin deficiencies.
Okay, well now that we have a patient presenting with it, what's our best option for treatment?
That is a tricky question. First, we need to reverse the damage. Then we need to treat what's already there. First, what we should do is remove the warfarin, obviously, initiate heparin and vitamin K, and also begin frozen plasmas. These will reverse the effects of warfarin in the body, but now we also have to use antibiotics to treat what she has. Our antibiotic that we'll probably use will be silver sulfadiazine, and we'll use special dressings such as foams, impregnated gauze pads, or hydrogels. It can require surgery such as mastectomies or amputations, and of course long-term anticoagulant with enoxaparin or restarting warfarin would be required. Other possible treatments that don't really have a lot of efficacy or data include hypothermia, oxygen therapy, and that's it.
Okay, well thanks for your input.
Yep.
You good?
Yeah.
Okay. I don't know what happened. I mean, it's just so weird that this happened to me. I mean, I could tell it was just something that wasn't supposed to happen, but I had no idea what to do. So, I mean, what should I know about this for the future?
Well, be sure to tell any of your future doctors or pharmacists or any medical professional that you interact with that you had this interaction in the past, because they'll be able to prevent from happening by either keeping you off of warfarin or by giving you the appropriate treatment. For example, we're going to keep you on warfarin, we're going to start you on a lower dose, and we're also going to give you a medication called heparin, which is going to, what they call bridge. So that's going to keep you from having this reaction for a short period of time, and then the warfarin, your warfarin will be stable again, and it won't cause this reaction. So after about a week, week and a half, you should be okay.
Okay, that's good to know. So, what else should I know about the medication?
If you start to notice that reaction again, like pain or something in your arm, or lower subcutaneous tissue, so your fat tissue or anything. Just be sure you call your doctor right away, let them know that that's happening. Also be really careful, monitor for nosebleeds or bleeding the gums and mouth, because warfarin will cause you to bleed easier. So also be really careful about handling sharp knives or stuff, sharp knives or sharp objects or anything. And also, you want to keep a constant vitamin K intake, and a lot of the vitamin K comes from green vegetables. So it doesn't matter how much green vegetables you eat. You can eat a lot, you can eat a little. Just try to make sure you're keeping that constant, because we'll adjust your warfarin dose based on how much of that vitamin K you're getting. So just make sure you try to keep that pretty constant. Other than that, you should be good to go.
All right, thanks for your help.
No problem.